We see them on the road all the time. Ambulances with sirens blazing, rushing to a potentially life or death situation.
But believe it or not, some of those calls are not emergencies, and that could have consequences for the rest of the community. And your side's Lex Gray spoke with first responders in Hampton Roads about 911 misuse. Lex?
Tom and Anita, the emergency workers I spoke with won't use the word abuse when they talk about people calling 911 for issues that simply aren't urgent. They tell me they will always respond no matter what. That's because what might not be an emergency for you or I could be a crisis for the person calling. So while they try to empathize with every patient, they also want people to understand what's at risk. Ask just about any EMT and they'll have a story like this.
We got dispatched to a toothache call.
I remember getting called for paper cut.
A broken nail.
The lady who had her pulse, wanted her pulse taken at 2 o'clock in the morning.
Out of these 3 Virginia Beach medics, Matthew Army has been around the longest.
I could probably sit here for hours and tell you stories.
Virginia Beach 911.
Stories of people calling an ambulance to refill their prescription or get checked for an STD or even explain their new medical equipment.
It's absolutely frustrating, especially knowing that a lot of these things, seconds do mean the difference between life and death on some of these calls, and knowing that we could have been there within 30 seconds, you feel powerless.
That's because no matter what the issue, EMTs say they're both ethically and legally obligated to work with the patient and offer them a ride to the hospital, even when a higher priority call comes in.
I do remember hearing a cardiac arrest going through, and there was a 3-year-old, and it was 3 blocks away, and we literally could not do anything. We had to sit on this scene that we were on and take care of the call we were currently taking care of.
The misuse even comes from doctors and nurses in other medical facilities. They'll call 911 to get a patient to the hospital even when there's no rush, and even though they could pay a private ambulance service. Virginia Beach EMS Chief Ed Brazel says cutting down on that kind of misuse would help. But there's not one single source of the problem.
We see inappropriate use of 911 services throughout the community.
Brazel explains, in low-income places, it's about lack of health care. For older patients, it might be that they simply don't have anyone to help but paramedics. And others might fall in the gap. They can't afford regular medical care, but they don't quite qualify for public assistance. And so they end up calling 911 to help them get out of bed or take them for a scheduled surgery. In extreme cases, emergency departments might prosecute, but overall, there's not much they can do but get the message out.
We're able to keep up with the demand, and we have a lot of resources in Virginia Beach. We're very fortunate for that. But it's taxing because we always want to be going where we're doing the most good, and often this isn't the best for the patient or for the community.
Now, Brazel says his department isn't at the point of being overwhelmed by these calls, but he and other department heads would like to cut down on them. And that's true for hospitals as well, who have to handle the patients once the ambulance gets them there. Bon Secours is working on one way to get preventative care where people need it. You can see that part of this story on WAVY.com. I'm Lex Gray, 10 on your side.